There is a large appetite for organizations in rural settings to expand telehealth coverage, expand technology that will help these patients gain access to more care in their area. We're seeing a lot of our patient base really having to access care outside of rural areas and in urban areas or even suburban areas due to the fact that they just don't have those specialties of care in their area. When urban and suburban areas are mapping out their communities, they're now having to make consideration for a much broader patient base due to the fact that these patients are traveling in from the rural areas to see these specialists. Things like a patient's ability to access internet, transportation, literacy, to understand what the discharge papers are saying and what their post-care orders are saying. That's a really big step in what these healthcare organizations are really considering when treating patients that are traveling a long distance. Urban areas have larger access to specialists. They have robust telehealth systems. In the rural settings, making sure that the patients can access the telehealth is something that's very important. In suburban areas, there is less available telehealth. It's thought that patients would be able to drive in to gain access more easily. And so as they have to expand their footprint of coverage, we may see that there is more of a demand for them to expand the telehealth services. When you have a limited amount of resources in the way of clinicians that are on site in a rural setting, maximizing the use of every moment these clinicians have is very important so that they can expand the patient access. Things like ambient AI that can take over for some of the charting and some of the paperwork and non-patient facing activities that our clinicians handle allow them to see more patients during the day. We also see different technologies in the creation of scheduling and the building of float pools across organizations. So you may have a healthcare organization that has several satellite locations that it sends a clinician to by designing various float pools based on the demands and needs in those areas. All of those are different ways of utilizing technology, but also strategies and considerations that these different types of healthcare systems have to consider when treating the rural patients.